Hello, welcome to Kidney Kong workshop on urine sediment microscopy. I'm Dr. Vélez, nephrologist from Oxner Health. Thank you for participating. So we're going to do a quick demonstration of a method to process the urine and prepare for microscopy. The method I'm going to show is not the only absolute way to do it. It's the way that the protocol that we follow here. There might be some variations depending on where you read or who does it. But for the most part, they're just minor deviations from what I'm going to show today. So first of all, you got to collect a urine specimen. Usually you would ask the nurse at the room or the patient himself or herself to provide a urine specimen. We receive the urine specimen on a urine cup. We try to ask for a clean catch. Sometimes the patients aren't able to void, and we ask them for a straight in and out catheter to collect the urine. Sometimes patients are connected to suction and negative pressure, and that type of urine pulls a lot of squamous epithelial cells, which is not ideal, so I don't try not to use those specimens. But often patients are not able to provide a specimen. They are in the intensive care unit and they have a Foley catheter, or it could be on the floor with a Foley catheter. So we have to always, I have here a Foley catheter kit, and you can see here the container where sometimes we see the urine being collected. We try not to collect the urine from this container because a lot of times has been sitting there for hours, where bacterial colonization can make the urine pH a little alkaline, and that may affect the stability of the integrity of the casts. So we don't try to collect there. So what I try to do is collect urine. This is the Foley catheter. As you can see here, this is inserted into the patient's bladder, and the urine, as it comes out of the bladder, is going to come here in the tube. So if you collect urine from the tubing, it's going to be relatively fresh. So that's what we try to do. So we obtain a 10cc syringe that is available at any hospital floor or ICU, and we come to this site of the catheter and screw it in. So it's important to come here, apply some force, and screw it in, and go ahead and aspirate the urine as it comes out, about 10 mLs or whatever you can get, and you get the urine. Usually they have a cap tip on the floor, and you seal it and take it to the lab. It's important to be aware that you don't want to be confused with this end. This is where the water is infused to put the bubble in the catheter and secure it. So believe it or not, I've been cases where water was aspirated incorrectly. So it's important to note this is where we collect the urine from. Okay. So once we collect the urine, here is a sample that in this particular case came from a cup. So we're going to transfer this urine to a tube. This is a 15 ml tube available, a Falcon tube in the lab. The first thing we do is we label. So in this case, we're going to call it patient X. The tube is labeled, and we're going to transfer the urine specimen to the tube. And we do that. There's no secret there. Just gently transfer it. In this case, it's a little bit more than 10 ml. So let's say we have 10 ml. That's enough. You could do less or more than 10, but because we try to do it standardized, we have here the 10 ml of urine. And this is going to go into the centrifuge. We have a 10 ml balance here, and it's going to go right across. And we're going to seal it and go ahead and centrifuge this for 3 to 5 minutes at a 1500 G force. Okay, so once you place the tube in the centrifuge, you have 3 to 5 minutes of waiting time. So this is a good time to label your slides. It's important to do that. You don't want to prepare a slide that is not labeled. If you are inspecting more than one specimen, you get confused. You don't know what patient are you evaluating, and that is obviously a problem. So this is what I'm going to label this again, patient X. I'm going to prepare 2 separate slides in this particular case, and we're going to get ready. So here is the tube. We already completed the centrifugation process. The first thing we do is we look at the pellet. And now you can see in this tube is a very, very large pellet, very sizable. I would say this is a larger pellet than the average. We're not lucky to get these pellets every day in every patient, but it's obviously a good pellet for inspection. So the next step is going to be to remove the supernatant, the urine that is the supernatant part of the urine. Now, this is something that standard laboratories would leave either 1 ml or half ml, sort of a standard protocol for every patient, because they have to quantify red cells, white cells per high power field, etc. So they need to follow a systematic protocol. However, because we do it for direct clinical care, we are looking for answers such as yes or no questions about presence of particles. We try to get the best possible pellet. So for that reason, what I would typically do is get rid of as much supernatant as I can. In this case, the pellet is so large that I may not do that. So what I would do normally is I would do this, vertically let the urine drop completely, and I typically would keep the tube dripping, and once you flip it, there's enough urine that sticks to the tube by superficial tension. But in this case, I didn't let it drip because the pellet was so large that it's probably good that we leave some supernatant so we can resuspend. It's already resuspended. This is a very large, milky, dark urine pellet that we're ready for plating. Okay, so we're getting ready to prepare the slide. So here is a pipette that it should be available in any lab, and here is the pellet. So we're going to prepare. We're going to see here, it's important not to overload the specimen of this slide. So this is a significant material here. You don't want to drop the entire material here. So as you can see, you squeeze gently and let one small drop. That is enough. I'm not going to put all this urine. Placing an excessive amount of urine is going to create a very thick layer, which is going to be actually more difficult to identify individual structures. So you don't want to create, you want to have a very thin film of urine specimen cover placed on the slide. So once you have that, I'm going to bring now a cover slip, and there are different ways to put a cover slip. I'm going to show you one of the methods. You want to try to avoid air bubbles. So one of the methods is to take about a 45-degree angle, let the specimen touch, and you see how the urine starts to spread along the edge of the cover slip, and just let it fall after that. As you can see there, the urine spread out evenly. There is a little bit of a bubble, but for the most part, it's a fairly nice even distribution of the urine specimen on this slide. So we're going to let that sit there. Now, the second slide is going to be the slide where we're going to be treating the specimen with the Starnheimer Mulvin or SM stain or SETI stain, Kova stain, etc. And we're going to this is the particular product I'm going to use for today's demonstration is a Kova stain, and we're going to place 1 drop of this stain into the specimen. Now, in this particular case, the specimen is large enough that I'm not that concerned of oversaturating the sample with the stain. But in general, it's important not to put too much stain that would overwhelm and would create artifacts. So that technique that I try to use is incline the tube by about 45 degrees, start to press the bottle so that the drop comes out and touches the wall of the tube and comes down gradually all the way down. So this is usually enough to stain a sample. As you can see here, it takes a few seconds, but once it comes out, all this urine is going to start to turn the pellet violet as expected. And in this particular case, is not as dramatic because this is a large pellet. Another example, this is not obviously a pellet that we're going to use for our patient care today. So you could do another example where you drop another urine, a sample like that, and you can see how it drips. So that's kind of the technique that I follow. I try not to place a full drop straight into the pellet because typically that's end up being too much of the stain. So we're going to take a separate pipette now and place. For this, I typically do a pipetting 1 and 2 and 3 up and down very gently, just to mix the stain very well with the pellet. You typically want to leave it for a few 30 seconds, maybe 2 minutes if you have the time. And then you're going to place the second drop. Again, try not to do a very large drop. You could place both drops into the same slide and prepare everything on one slide. I like to do it this way, but both ways are valid. And then we're going to put the cover slip, and I want to do a different technique, which is the different technique is essentially just to let it drop without touching it. And you can see it works well as well. Sometimes you do get a bubble in the middle. This is why I prefer the first method. But these 2 slides are now ready for inspection under the microscope. Okay, so we're ready for the final step, which is actually inspecting the urine specimen that we just prepared. This is a slide just to share what we find in this particular specimen. So the first thing I like to do is to look at a urine sediment with my eyes on the microscope. So I will be looking at the urine here, trying to see what type of findings we can identify. And this urine is filled with muddy brown granular cast, which is not entirely surprising based on the size of the pellet that we found in the beginning. So we're going to take this slide now. We can also show you in this particular station that is a microscope connected to an iPhone. So we can also see here under bright field microscopy, as you can see there, this slide full of muddy brown granular cast reflective of acute tubular injury. And this is just by bright field microscopy. And Dr. Seltzer will be explaining the next steps related to the image acquisition.